They say time flows like the Indus, sometimes fierce, sometimes forgiving. I remember the morning I graduated from IUHS in 2025. The air in Nawabshah smelled of heat, ripe mangoes, and change. I wore my white coat like a shalwar kameez stitched with hope. My name is Aisha, daughter of the desert wind, student of healing, and now, part of the story that changed our land. Back then, IUHS was already a beacon of hope, where compassion met science. But no one could have guessed what we would become over the next 20 years. In 2025, IHHN treated over 6 million patients annually, and IUHS was already making strides as a learning hospital. But those were just numbers. We were seeds. And seeds, if nourished by values, can become forests of futures. In 2026, the banyan of dreams sprouted its strongest branches. IHHN and IUHS jointly established a research and innovation fund, a crossroad where public institutions, private companies, and NGOs mingled like travelers at a Sufi shrine. They spoke different tongues, finance, medicine, policy, poetry, but they shared one prayer, a better tomorrow. That same year, 4 centers were born like quadruplets under the crescent moon. The Center for Biotechnology, where bacterial whispers taught us about curing and healing. The AI Tech Institute, where algorithms learned empathy. The Empathy-Based Sustainability and Foresight Institute, where the future wasn't just predicted, but embraced like a guest. And the Center for Gender Studies, where silence broke into stories and stories turned into policy. Each was rooted in the Indus strategy, a compass etched with 3 stars: compassion, collaboration, and curiosity. Our values weren't words, they were wings. In 2027, storms gathered. Trade wars in the West dried up donations like monsoon rivers in drought. Budgets shrank, programs withered. There were whispers of closing doors, but we remembered what Faiz said. Bol kelab azad hentere. We spoke. We imagined. We built. By 2030, the commercialization unit was thriving, turning IUHS research into revenue and patents into purpose. Our first biotech patent, a low-cost insulin delivery patch, brought in billions in royalties by 2032. We hired 200 new staff members with that one breakthrough. 65% of them were women. In 2032, floods raged. Water rose to the knees of our clinics. Nawabshah turned into a lagoon of sorrow. But the AI lab had just finished predictive disaster modeling. Within 48 hours, we rerouted ambulances, activated mobile clinics, and saved 80,000 lives. That week, empathy wore boots. By 2033, IUHS was no longer just a health sciences institute. It had bloomed into a multidisciplinary university, a caravanserai of learning where dancers studied anatomy, engineers read Rumi, medical students learned storytelling, and poets studied epidemiology. We launched schools of liberal arts, performing arts, humanities, and social sciences. The walls between disciplines dissolved like chini in chai. By 2035, enrollment had doubled to 6,000 students, with a gender ratio of 52% women, 47% men, and 1% gender non-binary, a first for Sindh. That year, I became head nurse and taught a course on compassion in clinical care. Students cried and healed at the same time. The pandemic of 2035 swept in like an invisible djinn. Then came the earthquake of 2040. Hospitals cracked, internet faltered, people panicked. But IHHN and IUHS had changed. The lifelong learning model launched in 2035 kept our staff updated, mobile, and resilient. Every staff member, from janitor to neurologist, had access to microlearning pods on disaster care, telemedicine, ethics, and mental health. The empathy-based foresight unit had gamified crisis scenarios. Our staff were ready, not just to save, but to hold, to mourn, to hope. By 2040, our staff strength had grown to 12,000 employees, and we had reached 5 million patients a year, still free of cost, still with dignity. By 2045, our campuses glowed like constellations. Our innovation and research hub has generated billions in patents and commercialization revenue, funding not just research, but scholarships, staff bonuses, and art festivals. The Gender Studies Institute influenced national maternal health policies. The AI Institute collaborated with global tech firms to develop Urdu language diagnostic bots. The Empathy and Sustainability Center trained 5,000 health professionals in eco-conscious clinical design. A new kind of wealth bloomed: compassion capital. Staff retention hit 93%, with employee satisfaction at 95%, especially among women from underserved districts like mine. My colleague Rani, a microbiologist from Khairpur, now led international research on antimicrobial resistance. Our compensation packages increased so much that brain drain stopped impacting us, driven by equity in research ventures, a far cry from the humble stipends of 2025. IUHS alumni led public health programs in Africa, wrote Urdu opera in Beijing, and launched community clinics in Quetta. We had become a global hub of ethical innovation, not by abandoning our soil, but by digging deeper into it. So here I am in 2045. I stand under the banyan tree outside the IHHN Nawab Shah campus, where birds nest in the stethoscope-shaped branches. I look back, and I don't just see years. I see 10 million more patients were healed with dignity, 10 new research centers alive with questions, thousands of students learned to treat bodies and souls, a network of global collaborators that stretches from Gilgit to Ghana. But most of all, I see the moment I took my first patient's pulse and whispered, "Khair to hai?" Because no matter how advanced we become with robots, biochips, data, the question remains the same. Are you okay? And the answer we give through medicine and meaning, through research and ritual, through poetry and protocol is yes, because we are here, together,